Namaste, I am Dr. Amit Mishra, radiologist, Perfect Imaging, and today I'll discuss about a very common condition which affects a lot of the population. I'm talking about fatty liver. So you must have heard about it, or at least maximum of you must have heard about it. It is a very common thing, and if you ever taken an ultrasound, most of you uh, have probably seen in the report that it's very commonly seen in ultrasound reports as fatty liver. So I'll describe a few things about fatty liver, what you need to know, and what are some of the things that you should be especially aware of. So fatty liver, as the name suggests, it means deposition of fat in your liver. So uh, liver has normal cells, and if there is a fat deposition, then there is a risk that the liver function might go down. So it can be in two groups of people. One who consume alcohol, the alcoholic group. So it is called alcoholic fatty liver, and the other group in which there is no alcohol consumption. Those people which do not consume any alcohol. So this is called non-alcoholic fatty liver. So these are the two groups in which fat liver can occur. So all of us, or at least most of us, know that if you consume alcohol, it causes damage to your liver. So uh, fat liver is very common in alcoholics, and if you are an alcoholic and you get a fat liver detected on your ultrasound, then you should stop alcohol, because it can lead to progression to more serious conditions like cirrhosis and permanent liver damage, which can be very problematic and even life threatening, and you might need a liver transplant. So to stop that progression, you should stop alcohol if you are an alcoholic. If you're not an alcoholic and you still have fat liver, then it is a non-alcoholic fatty liver. So what are some of the risk factors which can cause fatty liver in non-alcoholics? So if you have hypertension, blood pressure, that is, if you are a diabetic, if you have dyslipidemia, that is your cholesterol levels are altered, if you are a patient who is suffering from thyroid related diseases, hypothyroidism or hyperthyroidism, or if you have been on a long-term steroid use, so, or if you are obese. So these are some of the groups of people who do not consume alcohol and still have fatty liver. So in this group there can be again two groups of people. One which have a simple non-alcoholic fatty liver, in which ultrasound detects a fatty liver, and on ultrasound we see a fatty liver, but your liver function test, your liver enzymes, when we do a liver function test, that is a blood test, in that the liver enzymes are not significantly, not very altered, they are almost normal. So this is a non-alcoholic fatty liver which is uh, not very risky, and it remains stable for a long time, even throughout life, and does not cause much problem. However, on the other hand, some people will have a fatty liver on ultrasound and significantly deranged, significantly abnormal liver function test, that is a blood test, that will be significantly abnormal, and ultrasound will also show fatty liver. This is called NASH, non-alcoholic steatohepatitis. So this is a more serious condition, because this can be progressive, and it can uh, continually increase, and it can lead to liver cirrhosis, which is a permanent damage to the liver. So this is the group that we have to be uh, more aware of. This group of patients have to be more uh, conscious, more aware, and they should keep their screening going on every year for at least 2-3 ultrasound. They can take 2 or 3 ultrasounds a year. They can go for a liver elastography, which measures the stiffness, and they can do liver function test on a regular basis, uh, every 6 months, or every 3 months even. And if there is a progression, then this is the group that uh, uh, falls under NASH, which I told earlier, and there is a risk for liver cirrhosis. So this is the thing about fatty liver. I will recap everything which I told in the past few minutes. Fatty liver can occur in alcoholics and non-alcoholics, people who consume alcohol and people who do not consume alcohol. If it occurs in alcoholics, that is expected, because alcohol causes damage to your liver. If you do not consume alcohol and still have a fatty liver, then you are a non-alcoholic fatty liver patient. And this can happen due to diabetes, hypertension, that is blood pressure, thyroid related issues, obesity, long-term steroid use. So these are the common conditions which can cause fatty liver in a non-alcoholic patient. And sometimes we do not find any cause, that is, it can be idiopathic also. So in a non-alcoholic fatty liver patient, if your liver enzymes are not very deranged and ultrasound shows fatty liver, you should not be too much worried, because this is not a very serious condition. On the other hand, if your liver enzymes are very abnormal on liver function test, that is a blood test, and you have a fatty liver, then this can be a NASH, which is called non-alcoholic steatohepatitis. And these patients should be really aware, and these patients should get screening done frequently on intervals. Screening includes ultrasound and your liver function test and elastography. So this screening should be carried out in these patients, and they should be aware that this can be a progressive condition and this can lead to cirrhosis. So this is all about the fatty liver and its causes. Now, how do you manage, how do you stay safe in this condition, how do you treat this condition? So the mainstay of treatment is lifestyle and diet modification. That is, you do regular exercise, you lose your weight, you do not keep too much abdominal obesity, and you maintain a good weight, your good BMI, and your diet is good. That is, you eat healthy and proper diet full of antioxidants, green leafy vegetables. Then you do a regular screening, as I mentioned earlier. Then if you have these conditions which I described, like obesity, diabetes, thyroid, hypertension, you need to keep all these conditions under check and under control. So you manage it like this. There are many drugs which are being used, and many drugs which are under experimentation, but the mainstay of treatment lies with diet and exercise. So this is all about the fatty liver, which is a very common condition, as I explained, and everyone should be aware of it. Thank you.